Chapter 16 is a very important chapter. It may seem short as you begin to read through, but the terminology is critical for having a true understanding of the what will come in the rest of this microbiology course. Chapter 16 centers around the different ways we can look at diseases and how diseases are studied. After we go through this chapter, we will study the immune system, and then we'll begin looking at specific diseases. So it's very important that you have a good understanding of the terms in this chapter. The first term we need to go through is, of course, epidemiology, as that is the title of the chapter. So by definition, epidemiology is the field of science that studies really everything there is to know about a particular disease. So an epidemiologist is going to study where diseases occur, when you see outbreaks, how the disease is transmitted, um, any type of cause of the disease, whether it be a specific microbe or some other cause. But the epidemiologist is really going to tell us and research everything there is to know about a particular disease. When we're looking at the field of epidemiology and for the diseases we will discuss in this particular class, it's important that you always recognize two things about a disease. Those two things are the etiology and the transmission. The etiology is always going to be the cause of the disease. In this class, the etiology will always be a microbe present that is causing disease. With transmission, we are looking at how a disease is spread. So in this chapter, we'll learn the different categories we can place a disease based off of the transmission mode. All right, so moving on into some important terminology, let's look at how we can classify diseases based off of how they are affecting a population. So there's two kind of almost opposing terms, and that would be this first term, morbidity rate, and the last term on this slide, mortality rate. The morbidity rate is the number of diseased individuals out of a standard number of people within a group. So the morbidity rate is really how many people have a disease in a particular area. The mortality rate is going to be the number of people that have died from the disease. So morbidity and mortality can give us some important information as far as it can tell us just number of people that are dying versus number of people that have the disease and survive. What a lot of our healthcare workers use more often are the other two terms on this slide, the prevalence and the incidence. The prevalence is the number of individuals with a particular illness in a given population at a point in time. So the prevalence is going to take into account all particular cases. So that would be new and old cases. So just giving you this example from your textbook. Now this is looking back at 2012, but this is looking at people with HIV. So there's 1.2 million people with HIV. So looking at the population of the United States, or actually this is going to be worldwide populations, I believe, then you would say that 467 infected people per 100,000. That's just total number of people at this particular time that have HIV. Comparing prevalence to incidence. Incidence is going to be just the number of new cases in a set specific time period. So looking at that same time period, we were looking at prevalence. The incidence of HIV would only be about 13.7 new cases per 100,000 people. So if you compare these two numbers, 13.7 and 467, you can see the difference between incidence and prevalence. So in that 1 year, there were 13 new cases for this defined group, but overall there were 467 people. The incidence is just new cases. Prevalence is total number. So how can we use this number? Let's say in 2012 we saw an incidence of 13. Well, what if next year for every 100,000 people we saw an incidence of 43? You'd probably think, well, that's a huge increase in the number of new cases we were seeing, So that would mean that this disease is on a rise. Right. If we compare that, then maybe next year, say in 2013, it went from 13 down to 8. Well, that means we've made an improvement. Maybe some of our methods we're using to control the disease are working. So we can use these incidence and prevalence numbers to look for patterns. All right. So this particular slide is patterns of incidence. So depending on how many new cases we see in a defined period of time, we can classify a disease. Some diseases are considered sporadic. That means just within a geographic region, they only happen every now and then. So an example of that would be tetanus or plague or rabies. We may randomly see a couple cases a year in the United States, and we may see a case of tetanus in the Northeast, and then the next year we may see a case of tetanus in the Southwest. There's no real pattern we can see. It's just sporadic. Endemic is a disease that is always present within the population. Usually it's kind of at a low level, but it's always there. So things that would be endemic in the United States would really not be a whole lot of microbial infections. We control that pretty well, and we don't have some of the infectious diseases other countries do. But if we look at a country like Brazil, we can consider malaria endemic. That means that if you go to the country of Brazil, there's always somebody with malaria at all times. They always see new cases. An epidemic is probably the term you would be most familiar with. An epidemic is a disease with a larger than expected number of cases in a short period of time. So you're going to see a huge incidence all of a sudden. An example of that is the flu. Every year in the United States, we have a flu epidemic. We don't see incidence numbers of the flu year-round. Typically from about October to February, we see a huge increase in flu cases. So we have a flu epidemic. When an epidemic occurs on a worldwide scale, we consider that to be pandemic. So who is the group of people that has the job of reporting all of these incidence numbers and determining whether we have an epidemic or a endemic disease? The answer is the Centers for Disease Control and Prevention, the CDC. The CDC is an organization that is paid for by the United States government that keeps up with specific disease numbers in the United States. So the CDC has two main jobs. Number one, to protect the public health from disease. It does this by keeping up with a registry that the public health departments are going to submit numbers from. So this registry is really a database of diseases and how many people in the United States have the disease and things of that nature. And so there's specific diseases that if you go to the doctor and you have that disease, it is a requirement that that doctor's office report that disease to a specific agency that's sponsored by the CDC. So those diseases that are required that we notify the government are considered notifiable diseases. So certain STDs, certain viral infections, HIV is one of them, we have to notify the CDC. Measles is a good example of a notifiable disease. That's something that we vaccinate against, but some people have stopped vaccinating, so it's becoming an issue again, so those diseases have to be reported. The other job of the CDC is to publish a report called the Morbidity and Mortality Weekly Report. And I gave you the link that you can look at one of those reports so you can see what that looks like. So remember what the words morbidity and mortality mean. It's how many people have a disease versus how many people die from the disease. So let's get into a little bit more of this important terminology. So we want to look at how diseases are transmitted. So these three terms on this slide show you where diseases are really going to kind of hang out other than when they're causing specific disease. So one term that we need to know is a reservoir. A reservoir is the normal place that the pathogen resides. The reservoir is not going to be harmed by the pathogen. A reservoir can be something living, like an animal or human, or the reservoir can be a non-living site, like food, dirt, water, anything like that. There's two types of carriers, a passive carrier and an active carrier. A passive carrier is someone who has the pathogen and they can mechanically transmit it to someone else, but they're not specifically infected themselves. So the passive carrier is not going to have any sort of signs or symptoms of the disease. A great example of a passive carrier is a healthcare worker that may have a pathogen on their hands and carry it from one patient to another, but they actually are not infected with the disease themselves. An active carrier is someone who can transmit the disease to another. The active carrier may or may not show signs and symptoms. They are infected, but they do not always have to show a sign or a symptom. So let's look at the ways diseases are transmitted. One type of transmission is contact transmission. There's several different types of contact. Direct contact means that the person infected with the disease has to come in direct physical contact with someone that does not have the disease. Prime examples of direct contact are touching, kissing, sexual intercourse, things like that. With vertical direct contact, that's when a mom transmits disease to a baby, pregnancy, birth, or breastfeeding. Typical direct contact is horizontal direct contact. Just means one person to another. So these two pictures here at the bottom, this would be examples of direct contact, horizontal direct contact. Droplet transmission is a special type of direct contact in which the person comes in direct contact with mucus droplets from someone infected. So that's going to be this picture here, and that's just incredibly disturbing when you see the freeze frame of someone sneezing and all of those droplets. Indirect contact is transmission from one person who has the disease to another through an inanimate object or fomite that is contaminated with the pathogen. So if someone kisses, wipes their nose, sneezes onto an inanimate object, and then you pick that inanimate object up or you touch it yourself, that would be indirect contact. So we see the doorknob, the towel, any type of hospital instrument. So let's look at a disease like the flu. It's flu season as I record this. So could we get the flu from direct contact? We could. Someone with the flu could kiss someone else. That would be direct contact. Someone with the flu could sneeze directly in someone's face. That would be direct droplet. Someone with the flu could sneeze on a Kleenex, and then you pick it up to clean up after them. That would be indirect contact. So there are transmissions of disease that are not contact, and an example of that would be vehicle transmission. So transmission of a pathogen through a vehicle, such as water, food, or air. And so I picked a couple images to show you on this slide. So this really grosses me out. And you see all these restaurants now have the sneeze guard, which keeps people from contaminating food as bad. But if you've ever seen that kid digging through the buffet line and touching to their plate, touching their hands on things, and then putting it back in the food, that food could then be contaminated. And if you get sick from eating something, that's vehicle transmission. Now, water transmission doesn't happen as much here in the United States, but you have to realize in some countries, they don't have as clean of a water supply as we do. So you see in this picture here, this is a picture from India, but this is where their garbage is piled up, and it has direct contact with this water that these kids are swimming in. This may also be water that is used for an actual water supply that they're drinking. The last type of disease transmission is vector transmission. So this is going to be a bug. There's mechanical or biological transmission. So mechanical transmission is just when you have the vector, the bug, carries the pathogen, but it doesn't actually bite the pathogen. So I didn't put a picture of this on the slide, but you can think of if a fly lands on poop and then it comes and lands on your hamburger, it could have transmitted a pathogen from that pile of poop. More commonly, what we think of is biological vector transmission. For this to occur, the pathogen will typically have to bite you, so a blood exchange is going to occur. And there's several different types of arthropods or insects that can bite you. Mosquito is what we typically think of, but there is a called a kissing bug. He actually nibbles on mucous membranes. Ticks are considered biological vectors. This is a tick that's actually started to embed. So our last term to discuss together in this chapter is really the term emerging infectious disease. But to discuss that term, we need to understand the World Health Organization. So the World Health Organization is kind of the CDC for the world. It monitors and reports on infectious diseases that are occurring all over the world. And so the CDC is the United States way of working with all of these other countries to help control and prevent infectious diseases. All over the country, including the United States, we monitor diseases that may be new to the human population or that we've seen a change. We call these diseases emerging infectious diseases. So many things can lead to a change in disease. I listed just a couple here. Illegal immigration is leading to a couple of emerging infectious diseases in the United States. There's specific diseases that are common only in, or used to be common in Mexico, South America, Cuba, places like that. And with unmonitored immigration, sometimes fruits and vegetables will come in, bringing insects with them. And so you can see diseases and vectors coming into the United States. Microbes can sometimes evolve. We saw that with the swine flu, where the microbe that typically infects only swine or pigs began infecting humans. The bird flu, same way. Climate change is bringing malaria closer and closer to the United States because it's warming up. So we're starting to see the vector, the mosquito, specific mosquito coming to the United States. A really scary emerging infectious disease that the United States got first-hand glimpse at a couple years ago is Ebola. So you can see how Ebola has just seen this huge increase in incidence in number of cases in the past few years. And then we saw a flight attendant and someone who had been out of country bring Ebola to the United States just a few years ago. So if you're ever on YouTube looking for some interesting stories, you really should look up that Ebola incident that occurred. It started in Texas. Just a very interesting story.